The move to managed care for intellectual and developmental disabilities, or IDD, services. Guidance for state Medicaid and DD directors and payers. Medicaid managed care is a rapidly growing service delivery model in the United States. Managed care is a healthcare delivery system where companies called managed care organizations, or MCOs, get money from Medicaid to help deliver Medicaid services. While different states use different systems for managed care, states that use managed care hope that it will reduce costs while also increasing the quality of services. While managed care has been around for almost 20 years, it hasn't really been used to provide long-term services and supports, or LTSS, for people with intellectual and developmental disabilities, or IDD. This means there are not a lot of quality standards for managed LTSS for people with IDD. There's also not a lot of research about if it helps people with IDD or results in saving money. Despite the lack of evidence, managed care is expanding into the IDD LTSS system. For this reason, we believe that it's really important to have quality standards and guidelines. So we created a work group on MLTSS for people with IDD to help promote quality. In March 2019, CQL, the Council on Quality and Leadership, the Institute on Public Policy for People with Disabilities, and Mosaic held a second meeting of the work group with approximately 30 thought leaders in the healthcare and LTSS industries. At this meeting, we conducted research about quality services. This video is a summary of a report we created about what workgroup members believed are quality services and supports for people with IDD. Now, let's learn a little bit more about what's in the report. Here's what the workgroup members thought were requirements for quality. Health is a foundational component of quality. Before there can be quality, people with IDD must be free from abuse and neglect. Another foundational aspect of quality for people with IDD is having improved finances. Quality services for people with IDD require having a strong service system, including to support people in the community. An ideal service system for people with IDD would help promote natural supports. A stable and well-trained workforce is needed for there to be quality. It's also important to make sure people with IDD with more significant support needs are not left behind. Quality demands a cultural shift in the service system as well as by providers. Being in the community is not enough. People must be part of the community. People with IDD and their families should have high expectations about the quality of their services. And services and supports must be based on dignity and respect. Services and supports should be driven by the goals and desires of each person. Self-determination is a key part of quality. The service system should aim to be completely self-directed, where people can get what they want and need and receive the services to make that happen, rather than making people fit into a mold. People need opportunities to make informed choices. This involves education, experience, and exposure. Person-centered services should reflect the culture, routines, and traditions of the person and their family. Services should be designed around personally defined outcomes and what the person wants and needs. People should be supported to have a meaningful life. This support should be creative, accessible, and trauma-informed. Employment services are a critical aspect of quality supports. Relationships are an important part of quality, and organizational supports should help people build and maintain relationships. Quality services require business acumen, which means providers increasing their business skills. Technology is also an important part of quality. We need a system that starts by defining quality and then determines the measures to get there. The most successful path forward is one that starts with quality at the center of its goals, rather than focusing on cost savings. If people are not satisfied, the outcomes don't matter. While our work group is committed to continuing this work to help create a roadmap to quality services and supports for people with IDD, as the field moves to managed care, regardless of how we get there, it's critical that services maximize people with IDD's quality of life. This video was made by the IDD MLTSS work group. To see the full report, which is called The Move to Managed Care for Intellectual and Developmental Disability Services, Guidance for State Medicaid and DD Directors and Payers, or to find more resources like this, visit our website at c-q-l.org/MLTSS.